Pathopharm Part 2. So we have the drug methylphenidate. Its use is for ADHD, narcolepsy, and it is used to increase attention span. It is a controlled med. It is a class 2. Interactions are caffeine that may increase the effect. It also increases effects of oral anticoagulants, barbiturates, anticonvulsants, TCAs, and MAOIs. It decreases effectiveness of antihypertensives. Side effects and adverse reactions of methylphenidate is tachycardia, palpitations, hypertension, restlessness, tremors, irritability, dizziness, headache, blurred vision, euphoria, confusion, insomnia, anorexia, dry mouth, diarrhea, and then weight loss and seizures. The mechanism of action is that it stimulates the release of norepinephrine and dopamine, and it blocks the reuptake of norepinephrine and dopamine. The clinical judgment would be to take it before meals. So methylphenidate is amphetamine-like, and it is a controlled class 2. Now we have alprazolam. It is a sedative hypnotic, and it is also a benzodiazepine. So alprazolam is used to treat anxiety, panic disorders, and insomnia. The mechanism of action is that it is a CNS depression, and it has less excitability and stabilizes neuronal membranes. It is a controlled medication. It is class 5, which isn't that bad. Like I mentioned, it is a benzodiazepine, and the adverse reaction is hypotension, tachycardia, and seizures. The big life-threatening ones are liver failure and Stevens-Johnson syndrome, or SJS. The CJMM would be to monitor vitals. It is a high fall risk, and skin eruptions could occur. Another big one is respiratory depression, and we want to limit our use of alprazolam to 2 weeks or less. So it is used to treat panic and anxiety disorders and as well as insomnia, but by mouth, the onset takes about 15 to 30 minutes to work. Some side effects are lethargy, headache, constipation, amnesia, increased appetite, blurred vision, decreased libido, dry mouth, edema, and rash. The peak IR would be 1 to 2 hours, and then ER is 9 hours. So the peak IR of 1 to 2 hours is the most concentration of the medicine that's in your body. And then the ER for 9 hours means that it's slowly releasing over 9 hours in your body. The next drug I have is zolpidem. It is a sedative hypnotic again, and it is a controlled class 4. So zolpidem is a sedative hypnotic. Sedative hypnotic is just a thing of medication that kind of slows your brain down and makes you fall asleep. Zolpidem is a non-benzodiazepine, and the mechanism of action is CNS depression, and it's a neurotransmitter inhibition. It is used to treat insomnia, so it makes you go to sleep better. And the side effects are erectile dysfunction, amnesia, lethargy, and visual impairment. Some adverse reactions are suicide, ideation, dysrhythmias, and depression. Life-threatening of this would be pulmonary edema and renal failure. And then the CJMM is sedative, falls, and a really big one is safety. For zolpidem, it's short-term use, it's less than 10 days, and you want to reduce those doses in the elderly. It's a really big caution. The action is it's a neurotransmitter inhibition, and the duration of the action is 6 to 8 hours. It is a controlled medication class 4. That is all for Module 4 drugs.